A very good morning to everyone. I welcome you all to the bone pathology lecture series. Today we will be discussing on fractures, a little bit on bone healing. It's similar to the wound healing. We will see the steps of bone healing briefly, and then we will do a little bit of osteomyelitis. Osteomyelitis is mainly microbiology. I'll just cover the pathology point of osteomyelitis, and the major topic today will be bone tumors. So we will be classifying bone tumors and covering the major bone tumor, which is the osteosarcoma. So that is all for this session. We jump into the session. Fractures classification is very, very simple, nothing difficult, no complicated things here. Fractures can be complete or incomplete. So just the opposite of complete is just a new name, which is green stick for incomplete. So what do we mean by complete fracture? It's through and through fracture. A clean cut across the bone is complete fracture, and just the opposite is incomplete, where you can see the picture. The fracture did not go through and through to the other end. Okay, when does this happen? This happens in children. Like when the bone is still flexible, the bone may not crack through and through. So that is green stick fracture, common in children. And fractures can be simple or compound. So this picture shows a simple fracture. It's just one through and through cut. This is compound fracture. And here also it's one through and through cut. But what is the difference between this image and this image? So here, if you can see, the fractured fragment has deviated. Not only it is deviated, it is crossing the skin line. So this is the skin line and it is crossing it, which means the skin is also broken. So when the skin is also involved, it's not simple. It's a compound fracture or a open fracture. So fractures can be comminuted as well. Comminuted means nothing but, you can see this image, the bone has fragmented into multiple fragments. Okay, if there are multiple fragments, it's comminuted. And displaced fracture is nothing but the fractured bone fragment is disaligned. It has changed its alignment after it has been fractured, is displaced fracture. Spiral fracture, as the name says, when there is a twist injury, as you can see this image. So when there is a twist and the bone has fragmented like in a spiral fashion, it's spiral fracture. It's just the name and you have to know the types. Once you know the name, the description goes by the name. So there's nothing difficult in fractures. So I hope it's easy, and I'll move on to other fractures, which are complicated fractures. Nothing but when the adjacent tissues are also damaged, adjacent soft tissue, blood vessels and nerves, when they are damaged, it's complicated. Depressed fracture happens only in the skull. Okay, when the skull bone, when a fragment in a spherical skull bone is fractured, the fragment tends to go in, sucked in. Okay, so that is depressed fracture. As the name describes, depressed is bone being depressed after a fracture. Stress fracture is repeated stress over a same bone, which happens in athletes while marching, army recruits, and dancers, when small bones of the foot are repeatedly under stress. And yeah, at some point of time when the bone gets fractured, it's called a stress fracture. And pathological fracture is any diseased bone. Any metabolic disease, even osteomyelitis or after bone tumors, any disease which has caused the fracture of a bone is pathological fracture. Okay, so these are the names of the examples of the diseases that can result in bone fracture. Okay, it can be any disease, even osteoporosis, any metabolic bone disease, osteomalacia, even tumors, even congenital bone disorders. So whenever the bone is diseased and is weakened and that has resulted in fracture, then it is pathologic fracture. Okay, so these are general consensus before knowing like how a bone can bone fracture heals. Nothing difficult. Logically, you can imagine complete fractures, simple fractures will heal more quickly than incomplete, compound or comminuted fractures. Okay, healing process is the same, but it will take longer duration because in comminuted fractures, bone is in multiple fragments. Okay, so put together all the fragments has to be reabsorbed and new bones have to be formed, so it will take a longer duration of time. That can result in delayed fracture healing. Compound fractures, your skin also is involved. And when the skin is broken, there is a high risk of the bone being infected. Okay, when infection complicates wound healing, it's going to be delayed as well. It's going to take a longer duration than a non-infected fracture. Healing of bone, similar to skin wound healing, the first step is hematoma formation, and then the hematoma organizes. So when it organizes, the next step is formation of granulation tissue. In granulation tissue normally happens in wound healing as well. But here, this granulation tissue, the next step will be procallus formation. Okay, callus is nothing but undifferentiated cells will be there, which means the cells which are capable of differentiating into bone cells. Okay, or otherwise osteoprogenitor cells will be present in the callus. Callus is nothing but granulation tissue. Granulation tissue, already you know in wound healing, the routine granulation tissue composed of inflammatory cells, fibroblasts and blood vessels. And this granulation tissue is going to contain osteoprogenitor cell. At this point, it is called as a soft callus. Okay, these osteoprogenitor cells are the ones which are going to become osteoblasts. And once osteoblasts are formed, the function of osteoblast is bone forming. So they are going to form osteoid. They are going to produce osteoid. Once osteoid is produced, calcification happens. Mineralization of the osteoid happens. Now it's no more soft callus. What has it become? It has become hard callus. Okay, callus, there will be two callus, external callus bridging the outer ends and internal callus bridging the medullary cavity. Okay, so then ossification happens. Initially, the bone formed will be woven bone. Woven bone, you already know it's immature bone. In children, all first bone which is formed is woven bone. Okay, and then woven bone will be replaced by lamellar bone where parallel trabeculae are formed. Okay, and then like any other wound healing, remodeling also will be there, which means there will be excess bone, excess callus formation will be normally there, which will be remodeled by resorption. Excess tissue, excess bone will be resorbed. That is remodeling to fit the need of that area. So how much weight bearing the bone needs to carry, according to that, remodeling will